As a spine surgeon, the most common conditions I treat are people with herniated discs, people with compressed spinal cord or compressed nerves. We call that spinal stenosis. And also people with scoliosis or spondylolisthesis. All conditions that are degenerative usually. Symptoms that people often present with when they're talking about neck and back pain. For the neck example, the pain often travels down to the back of the shoulder, trapezial area, and occasionally down the arms into the hands. You can get both pain and numbness, or weakness, numbness. It really varies depending on where the pressure is on the spinal cord or nerve. But just axial pain in the neck and shoulders can be either from a pinched nerve or a translation or an annular tear in the disc. I think the other things that people need to be aware of is the common degenerative conditions in the low back. Most of us wear out discs as we're getting older, some unfortunately younger because of genetics. The typical thing is when you bend forward and you injure your back, and that's typically a disc injury. Avoid the bending forward and let the disc heal up is the typical course, but sometimes it's going down the leg with some numbness and weakness. That's typically a herniated disc. The vast majority of people as they get older will have some sort of spinal stenosis. In the cervical spine, it may be pinching the spinal cord where you get dexterity problems, balance problems, coordination problems, tremors. In the low back, when you get spinal stenosis, it gets difficult to really stand up for a while. You want to go sit down or lean on something, you're always looking for a seat. Those people are fairly easy to fix. It can present with just back pain, buttock pain. It doesn't always have to present down the legs. But just knowing about it is half the battle, and then realizing when treatment makes sense. We really have an expertise here in scoliosis. The training is both in adult and pediatric, and we see some really advanced deformities in the spine, both in a sagittal and coronal plane, and that means the spine can be twisted and curved from a right to left or right or forward and backwards. So there are some new technologies with treating scoliosis, particularly in adolescents, which is the younger folks. We have a large young population with spinal deformities where they come in with small curves noted by their pediatrician or hospital nurse, all the way up to very severe curves and neglective scoliosis. We have a special scanner called an EOS machine, or an EOS scanner, that is really a head-to-toe complex X-ray machine that is less radiation by a long shot than a regular X-ray, and allows us to see the spine in a three-dimensional fashion. It allows us to see things and be able to treat things that really we couldn't before. So some of the newer things that we do with spine, in addition to some advanced imaging, such as the EOS, is that we also try to utilize an approach that looks at your spine, how it is when you're upright. It's very difficult for many practitioners to look at an MRI or a CT scan that's supine and try to extrapolate that to their upright position and how their spine collapses with gravity. And our goal is to try to put those two things together, find out their pain generators, and try to see if we can do something selective to address their scoliosis, or something that treats the entire curve, which may be more significant, but also could be very effective. Surgery is considered on a patient typically when they've failed non-operative treatment, but also when somebody presents with a significant neurologic deficit. We don't typically like to watch people with a lot of weakness or cord symptoms. We also will treat people when they're in incapacitating pain that's not managed well non-operatively. Many people that are going through years of pain and disability, multiple injections and even spinal cord stimulators, that really all they needed was a short little outpatient procedure and they get their lives back. So I would just suggest that they come in to see us and know that our goal is to do the least invasive thing, but also something that's effective to get them on the road to recovery.